So there are, for CLL patients, one of the most important findings is that in the front line, the recently approved drug, at least in the front line, ibrutinib, has resulted in really durable remissions. Susan O'Brien updated 5-year follow-up data showing that only one patient had progressed in a group of 31 patients now more than 5 years out from initiating therapy. And that's very reassuring. The finding that wasn't highlighted in the meeting, but is probably the most interesting to me, is that in that group of patients, 35% have actually discontinued treatment for a variety of reasons other than disease progression, and yet there's only been one disease progression. And that provides us some early evidence that there is perhaps a strategy out there for discontinuation of these drugs. Secondarily, we're starting to see that studies that combined chemotherapy and kinase inhibitors are continuing to read out. And while they represent an advance over chemotherapy alone, it's not clear still that they represent an advance over kinase inhibitor strategies without chemotherapy. And so I think we're gradually migrating, this meeting makes clear, to a future of novel combinations that may dispense with chemotherapy altogether.